Vaginal discharge is common, especially after puberty. You know, after puberty is when we get to experience a lot of hormonal changes, and after puberty is when you get to find a lot of changes in our vaginal discharge. It's very common for you to have vaginal discharge, and let no one tell you that it's abnormal for you to have abnormal discharge. What's up, guys? Welcome to Let's Learn with Nurse Grace. My name is Grace Hezekiah. I'm a registered nurse. So in this video, we'll be discussing about different colors of vaginal discharge. And you know that during our cycle, we've got to have different types of vaginal discharge. So I'll be telling you basically on the different types of color of vaginal discharge and whether they are normal, if it's abnormal, how to treat them, if you can treat them at home, and if you need emergency medical attention. Welcome to my video, and if you're interested about what I'm going to be talking about, please make sure that you watch this video until the end. Thank you so much for those who have already subscribed, and make sure that you subscribe to this channel. So having a vaginal discharge is it's completely normal, and you can find that in different types, depending on whatever time of the cycle you are, you can get to have different types of vaginal discharge. During vaginal discharge cleanses itself, and after it cleanses itself is when that we get to have this vaginal discharge. And in other case, you can have different kind of vaginal discharge if you have different kind of maybe infections when you're in different days on your cycle, and so on. So I'll be telling you on the different colors of vaginal discharge and what they mean. So the first color I'll be talking about is yellow-green. So what causes yellow-green? So if you just hear about yellow-green, definitely this discharge is not normal. It's normally caused by an STI. So we've got two different types of STI that causes your vaginal discharge to be yellow-green. The first one is trichomonas vaginalis. So if you've got trichomonas vaginalis is simply a bacteria caused when you get to have unprotected sexual intercourse with someone who already has it. So the different, you get to experience different signs and symptoms. For example, itching, burning, and maybe scratch. You might get to have the labia look red and a bit swollen. So those are the major signs of trichomonas vaginalis. Also, this type of vaginal discharge, it can also occur in an STI known as gonorrhea. So if you've got either of these two, either trichomonas vaginalis or gonorrhea, you get to have a discharge that is yellow-green. So what do you do when you have this kind of condition? What you do is that you go to the hospital, because in most cases there's no way you can treat yourself back home when you've got to have this trichomonas vaginalis, or if you've got to have gonorrhea. You have to visit the hospital so that the doctors will have to get a sample from you, either urine, blood, or anything. So after that, or they can do a swab on you on the vagina. They can get to know what exactly is causing your yellow-green vaginal discharge, and therefore they're going to be giving you antibiotics that are going to be treating that infection. And I will also advise that if you've got a partner, a sexual partner, or partners that you've had sex with within the last about 1 month or so, it's also advisable for them to also seek treatment, and for you to, when you're already starting on your antibiotic or on your treatments that you've been prescribed, it's better for the both of you to prevent having sex during this time of when you're having the course of antibiotics. So that's the first the color of the vaginal discharge that I'm discussing about. So the second one, we have clear vaginal fluid. So having clear vaginal fluid is very normal, and this is the normal vaginal fluid that most people have if you've got no infections, and it's very clear. You can see that, and it varies from different days on your cycle. So you can get to find that during most cases, when you're about to ovulate or when you're actually ovulating, you get to have that your vaginal discharge is so sticky, and it's very, very clear, and it opens up like a string. It looks like an egg white. Basically, it looks like an egg white, and when you try to stretch it, it's very sticky and it stretches out. So that's what happens during your ovulation period in most cases. So in most cases, this vaginal discharge has got no smell, and to some other cases, it might have acidic smell depending on the acidity of your vagina, depending on the kind of acidity or the condition of the pH of your vagina. So it might have smell or might smell like a part of acidity. It's very normal, but in case you find that there's something that is abnormal, please go to the hospital and see a doctor. So the third one is red or pink color. So you get to have, if you have the red or pink color of vaginal discharge, this normally happens when you're on your periods. When you're on your periods, you can even say that even when you just go to the toilet and try to wipe yourself, if you wipe yourself like maybe with a tissue paper, and before you just start your period, you might see like a bit pinkish or some bits of red. So that's when you know, like, yeah, my period is coming. And obviously during the period itself, it's a bit red. In most cases, it's red. So this is one of the causes of red or pink discharge. And you can see that towards your cycle, towards your period, you find that your vaginal discharge is a bit brownish, because you know, when after your period is done, then there are just some bloods that are remaining there, so they're just trying to clear up. So during that period is when you get to have your brownish color of discharge. So another thing that can cause red or pink discharges, if you've got is just post-sex or post-coitus. So there's some people who actually bleed, especially shortly after they've had a sexual intercourse. So it might be from about few minutes to up to even 24 hours. So just depending on you yourself, on the condition of your vagina, on your cervix, because there's some people that experience some sort of pain, and there's some people that can actually maybe have some injuries during or after, and there are those people who generally bleed after sex, although it shouldn't be too much bleeding, just a little bit of spotting. And it's quite advisable for you to keep on monitoring, because if it's something that is going on for some period of time, it's better for you to seek medical advice. So the third thing that can also cause vaginal, for you to have red or pink vaginal discharge, is when you're on your menopause. And during your menopause, you know that normally most people don't have any vaginal discharge, any bleeding or any periods during that time. But in case you're on your menopause and you get to have some periods when in between you're experiencing maybe spotting or bleeding in between your cycle, then it's very, very advisable for you to seek medical attention, because in most cases it's an indicative of endometrial cancer, of which at some point, if it's detected early, they can start you on some sort of medication or chemotherapy that can help with that. So it's better for you to start to seek medical advice in case you have such. So another thing that can cause red or pink blood discharge is during implantation. You know that this can happen when, especially, you know that you had unprotected sexual intercourse, and it's just a few days or just the exact day that you're supposed to be having your menses. When you go to the toilet, you can try and wipe yourself. When you wipe yourself, you can see a bit of pinkish. It's normally pink in most cases, the implantation bleeding. And implantation bleeding happens just immediately after fertilization. And it happens because after fertilization, the egg and the sperms, after they fuse together to form a baby, then the fertilized ovum needs to implant itself into the uterus so that it can start having some blood supply and everything, oxygen from the uterus. So it like embeds into the uterus. So during that process is when some people get to have implantation bleeding, and in most cases it's pinkish. So if you at some point you get to experience this, and you know that you had unprotected sex at some point in your cycle, and you know that you had unprotected sex in some point in your cycle, then know that it might be implantation bleeding. So the fourth color of vaginal discharge I'll be talking about is cream or whitish. So in most cases, if you experience this cream or whitish vaginal discharge, it's an indicative that you have thrush. It's known as thrush or yeast infection. So in most cases, if you have this yeast infection, this vaginal discharge that you have, it looks like a curd, or let's say like a custard cheesy, or it's very white and very is it fluffy or what? Yeah, it's just like some sort of milk. How do I say it? You can see from the photo there. So it looks like cheesy like substance, and it's very white in color. So if you get to experience this, in most cases it's caused by yeast infection. So why do you have this yeast infection or thrush? So you know that vaginal has bacteria, has some healthy bacteria, and it also has some yeast which stay there in the vagina. They are very healthy, and in cases that there are some cases that when your body fights off this bacteria, because in most cases the bacteria and the yeast, they get to fight for space there, and therefore normalizing the area of the vagina, so everything gets to be normal there. But in some cases, like in cases that you take like antibiotics or something, then you get to find that your antibiotics come to destroy that healthy bacteria. And if they destroy it, it means that this yeast that is there, then it's going to grow. And if it overgrows, of which it's not supposed to overgrow to a certain amount, then you get to have this yeast. And some of the signs and symptoms of yeast is you might feel very itchy, you might feel burning sensation when passing urine, and you might feel also your labias might become swollen or red at some point. So normally, there's in some cases, not everyone experiences these signs, and you can also be asymptomatic. So there's a period that you might not like have to like treat it depending on how far it's gone. So there are some people that it just come for like a few, maybe 2 days and 3 days, and it disappears, especially those who are on the course of antibiotics. And there are those people who come and goes. So when it's at this point, then I would advise you to seek medical attention. Go to the hospital, let the doctors have maybe a swab of you, let them maybe take a sample like urine and test and know what exactly is the cause of the infection, and let them treat you accordingly. So the normal treatment, whatever they can give you, is normal pessaries, the pessaries which you can insert into the vagina. They can also give you some cream which you can also apply there. So there are different types on depending on how far, on depending on the doctor, or depending on yourself, or maybe allergies. Then the doctor will get to choose which is the best kind of medication for you to have. So also like to tell you that during this process, it's better for you to prevent having unprotected sex. Just remember that it's not an STI, and it comes about with the changes on our vagina and everything. So it's not a sexually transmitted infection, but to some point it may be passed from one sexual partner to the other. So it's better for you to seek medical attention. So the last one is a gray in color. When you've got to have a vaginal discharge that is gray in color, it's normally caused by bacterial vaginosis, and bacterial vaginosis is not an STI. It simply occurs when there is a change in your pH of the vagina. So what can cause these changes in pH of your vagina? So the first thing is if you like douching. Douching is like maybe trying to like spread a lot of water, like maybe when you shower, you take the shower and try to wash and rinse your vagina very well. You pass it with a lot of water, that's douching. So if you do that, you destroy the pH of your vagina. In those cases, people who have a lot of bubble baths and having lots of different kinds of temperatures, it also destroys your pH of the vagina. Also, those people who wash the vagina with different kinds of soaps or detergents, or those who even spray, so it may interfere with the pH of the vagina. And if it does interfere with the pH of the vagina, it means this bacterial vaginosis is going to grow, and it's not an STI. So it just basically happens when there is a change in pH of the vagina. So this bacterial vaginosis is commonly known as BV. It brings out a fishy smell, like when you smell fish, it's like a fishy smell. So when you've got to have this fishy smell, just know that you've got BV or bacterial vaginosis. And it's normally prominent, or you get to have to smell it so much, especially when you just after having shower, or maybe after sexual intercourse is when you get to find that you have this kind of smell which smells very bad, and it's so fishy like smells. The good news is that it's very treatable, and it's treated by maybe taking tablets or cream or maybe pessaries, depending on yourself or any allergies that you've got, or depending on the doctor. So it's very treatable. And I will also advise you, don't be scared. Don't be scared to seek medical attention in case you've got any of those signs, any of those colors, different colors that I've mentioned that are caused by infections. Don't be afraid to seek medical advice so that you get treated, because if you don't get treated, there are those kind of vaginal discharge that get to be passed from one person to the others. And if you don't get treated, they can develop to some other things that maybe cancer or anything. So it's better for you to get treated at the most time that you've got, and also make sure that you and also the other sexual partners get to treated. So let's go ahead to self-care. How do you take yourself to prevent this kind of different colors of vaginal discharge? So the first thing is to good personal hygiene. When you have good personal hygiene, for example, avoiding douches, avoiding certain spraying perfumes, avoiding certain soaps. If you do this, then there's a possibility that you're going to be preventing this kind of vaginal discharge. Then another thing is practicing safe sex. It's not like when you practice safe sex, it means that you're on your, maybe you're having family planning, you're having maybe whatever. That's not safe sex. Safe sex is basically using a condom. That you can see that I've already mentioned that there are those STIs like gonorrhea, TB that are sexually transmitted. So using a condom is basically protecting yourself from having acquiring this kind of sexually transmitted infection. So practicing safe sex is very important. Another thing is for you to make sure that you wear cotton underwears. You know, putting on synthetic underwears or any other, or nylon or something, there are those underwears that are very good environment for this kind of yeast or this kind of bacteria or fungus to grow. And it's very important for you to, if you live in the place where you've got lots of sunlight, please make sure that you put your underpants or your underwears on the sun so that they get to dry very well before you putting them on. And the last thing is for you to seek medical advice. If any of this doesn't work, if you've tried like many various ways at home that don't work, so it's very important for you to seek medical advice. Thank you so much, guys, for watching this video. If you haven't subscribed, please make sure that you click on the subscription button so that you can continue providing many content as this. Thank you so much for watching. See you on my next video. Goodbye.